Hello,
Hello,
everyone.
everyone. Hello, everyone. We are talking about chronic headaches today and how integrative medicine can help. To talk about this, we have Dr. Taimoorazy MD, who is a specialist in intervention pain management. Welcome, Dr. Taimoorazy.
Thank you very much for having me. I'm hopeful to have a very constructive discussion. As you mentioned, my background is interventional pain medicine, and I'm a headache subspecialist. So we see quite a number of patients that are really suffering pretty badly, and the neurologist or the neurosurgeon have not been able to help. So then we get the referrals. So we are here to talk about holistic approach and what other things out there is available to all of us to implement to take care of our headaches. Now, there is a big difference between, all kinds of different headaches. So we just don't have migraine headaches. And one important misunderstanding out there is every time a patient walks into a clinic or they talk to their friends, the assumption is that it is a migraine headache. That is really not a correct understanding of headache disorders. There's a variety of headache disorders, but for sake of this discussion, we would be focusing on migraine headaches and tension type headaches. The reason being migraine headaches, despite that they are very frequent and a lot of people suffer from them, but they are also very disabling. Person with migraine headache, they have this most horrific throbbing pain that is pretty much taking them out of commission. They have to go to a dark room because they are so light sensitive. They have a lot of nausea. They are throwing up. They are completely disabled until this attack is over, which that may last 8 hours or upwards of about 24 hours. So what is out there for us to do for these patients? And fortunately, the science has advanced, and there's a lot of research behind many, many different therapeutics that we have now. And some of them are pharmaceutical, very, very effective. But unfortunately, a lot of these pharmaceutical agents and medications have inherent side effects, and some people cannot tolerate them. Some people are, fortunately or unfortunately, against taking any prescription medication because they say, I don't want to take chemicals. So, what is out there for us to do to manage these headaches? You will be surprised how simple lifestyle changes can really mitigate significantly your headaches. Let's start by first talking about exertion. So, exercise, namely low impact aerobic exercises, are extremely important in mitigating the frequency, severity of a migraine attack, or even the whole process of migraine may be completely inhibited by doing a routine daily exercise regimen. By that, we mean you have to be doing a low impact aerobic exercises about 30 to 50 minutes a day. Now, what happens when you do that type of exercise? We have our own endogenous, which means our own something that belongs to our body. It's not chemical from outside. So we increase the level of those neurochemicals by just doing a simple 40, 50 minutes exertion on a daily basis. These neurochemicals are referred to as endorphins. Endorphins, once the levels go up, it gives you a sense of euphoria. It gives you a sense of achievement. It helps deal with anxiety and stress, which both of them are comorbidities of migraine. So a lot of migraine patients, unfortunately, they have sleep disturbance, they are depressed, either directly because the headaches really is depressing. If you're suffering from headaches on a daily basis, it is a lot to deal, with that. So depression and anxiety are comorbidities of migraines. But if you're doing this simple exertion every day, the level of endorphins, which are those neurochemicals in your bloodstream, goes up. There is a direct correlation between exertion and triggers for migraine. So migraine threshold basically goes up. The trigger goes up, meaning that you have to have a really, really bad situation, a bad attack of a migraine to start suffering from that migraine episode. So that is very important to keep in mind. So do on daily basis about 40 to 50 minutes of make it a routine. Make it just like, you have to drink water, which we will get to that also. But just like that, you incorporate that in your daily life, you will be surprised that roughly about 50% of your headaches will decrease by just exerting. The next thing that you have to do, which is again, believe it or not, astronomically will tip the balance and in your favor and decrease the severity and frequency of migraine headaches is hydration. And by hydration, we mean water. Don't drink plenty of coffee. You think you're hydrating yourself, or Coke or pop and soda. No, don't do that, because within those drinks, most of them, they contain caffeine, which is, of course, a good remedy for migraines only if you use it occasionally. You would use it as a medication. So if you have a bad migraine attack, once in a while, if you drink a good cup of coffee, you will notice the headache pretty much may resolve. But on daily basis, if you drink about 2 liters of water, studies have shown that the migraine threshold, the threshold for triggering of that pain decreases significantly. And the other thing that happens is around our brain, we have something that is called spinal fluid, which of course, most of it is water. And then spinal fluid helps to maintain the brain within the skull in a floating position. So if you're dehydrated, then there's less of that fluid around the brain, and the brain may start sagging. When it is sagging, it will start pulling on the nerves and on the layers that covers the brain, which that predisposes you to more severe migraine headaches. So that increases the intensity of the headaches that you're experiencing with migraine. And lastly, as far as lifestyle changes is concerned, is sleep hygiene. You've noticed that your laptop, your computer, if you leave it on for a long time, it starts malfunctioning. So what do? You just turn it off for a few seconds or a minute or so. When you turn it back on, it's working fine, right? Same thing happens with our brain, because sleep cycle is controlled in a specific part of our brain that is called diencephalic region, or brainstem. Brainstem is also the region that migraine, actually in people who are predisposed to migraine attacks, that is where those neurochemicals go crazy and start triggering those impulses that ultimately gives you attack of a migraine. So a good sleep hygiene goes a long way, can significantly decrease your frequency of migraine attacks. Now, we all know that sometimes we eat something and that may act as a trigger. For instance, for a lot of people, alcohol is a trigger. And there is good science behind that it triggers migraine attacks. So years ago, the American Academy of Neurology and the American Headache Society, they started a big campaign and research on how supplementation with certain nutrients can hopefully may significantly decrease our predisposition to migraine attacks. And this basically was conducted over a long period of time. And at the end, they came up with an efficacy level for certain nutrients or food items that you would need to consume to decrease the severity of your headaches or even prevent your migraine headache attacks. Science has shown that migraine is a nutritional deficiency syndrome of the brain. So what happens is that our brain, the nerves that of course comprise our brain, they need certain nutrients to function normally. And in people who are predisposed to migraine headaches, they are deficient either because of a metabolic abnormality or genetic abnormality. As we know, a lot of people have a genetic predisposition to migraine attacks. So ultimately, the deficiency of these certain nutrients predisposes this individual to a cascade of events that results in an oxidative stress to the brain. So basically, migraine is a metabolic abnormality with high levels of oxidative stress. And so if we could decrease the oxidative stress using certain nutrients, we may be successful in preventing and treating migraine headaches. And that was the basis for that research conducted by the American Academy of Neurology and the American Headache Society. And there are certain nutritional supplementation that stands out significantly, that recommendations are now out there for, we give it to our patients, we tell them to consume or take extra this or extra that. And the main ones that have shown really a good track record and safety, of course. And ultimately, as a physician, as any healthcare provider, we want, of course, to do no harm. We want for our patient what they are taking as far as a medication or a supplement or a procedure to at least not harm them, but also improve their problem or their condition. So the supplements basically are meant to decrease the oxidative stress and decrease the inflammatory process that is part of migraine pathophysiology. So the important ones, one is magnesium, one is alpha lipoic acid, the other one is vitamin B2. As you see, these are all very routine and simple things. Actually, many of what is recommended to be taken, we have it in our own body. Like we need magnesium, but we need a little bit more of it to prevent migraines. Our body has significant amount of alpha lipoic acid, which is a very, very important antioxidant. A recent research study has shown that alpha lipoic acid is significantly decreased in more than 90% of patients who are suffering from high frequency migraine headaches. So supplementation with alpha lipoic acid being an antioxidant is extremely important. The others are the two herbs that basically have been used for a long, long time. Feverfew and ginger. Everybody knows how good ginger is. So if you supplement with ginger and feverfew, you decrease inflammation, you prevent the nausea of migraines. And ultimately, another supplement is coenzyme Q10, which again, we have it in our body. So as you see, we have most of what we just said, we have it in our own body. We just need to supplement that. And we've been using this in our practice very effectively. A lot of neurologists, pain management doctors recommend supplementation with these ingredients. Now, one word of caution, if one is thinking about supplementing their diet to prevent or help with migraines, is an herb that is called butterbur. Butterbur is a very powerful, very effective agent or a compound that helps mitigate and prevent migraine headaches. The only problem with that is migraine is sometimes a decade or many decades long process. So if you are to take a prescription medication, you will be taking it for at least 10 years or 20 years. If you are to take a supplement, you need to take it for an extended period of time. So therefore comes in question the issue of safety of what we're taking long term. So butterbur is safe if you were to take it short term, like 1 or 2 months, it's probably okay. But within butterbur, there's a compound that is called pyrrolizidine alkaloid, or PA for an abbreviation. So pyrrolizidine alkaloid is a really bad substance for our liver. So a lot of people, unfortunately, in the past that they were taking butterbur, they suffered severe hepatic injury. They developed jaundice. Rarely they have complete hepatic failure and shutdown requiring liver transplant. So nowadays there is a form of butterbur that is PA free. You want to make sure if you are to use butterbur, you have to use PA free butterbur. But still, because of the issue with purification of butterbur, we still are not certain that if a compound, if a supplement that is out there on the market, if they claim that it is PA free, again, the science is not 100% supportive of that claim. Therefore, the American Academy of Neurology and American Headache Society have not yet stood behind Butterbur for a long-term use. So outside Butterbur, I would say the other agents that we talked about, magnesium, vitamin B2, feverfew, ginger, coenzyme Q10, alpha-lipoic acid have been shown to work synergistically, and which means they work together and they help each other out, and they are significantly effective as an anti-inflammatory and antioxidant agent, which ultimately is the problem in a migraine case. So I know I talk too much, but there is so much to say, and I'm really passionate about this. As a headache subspecialist and interventional headache subspecialist, we have a lot of tools in our toolbox, from specific procedures, surgical procedures, prescription medications, but there is multiple answer to a question, but ultimately safety and efficacy for a long-term use stands out to be the most important consideration that you have to make.
I think that's great. We just wanted to introduce that there is integrative medicine that you talked about, whether it's a sleep, whether it's a hydration, whether it's exercise, supplementation, nutritional deficiency. I mean, this is a huge topic that we can go on and on, especially for people who have nutritional deficiencies, and that's why they get the headache. And there's also a lot of research that I had interviewed. Actually, it's interesting. An Ayurveda physician from India that has been a research done, and clinical trials are done, as some herbs how they can impact your migraine headaches and can probably help give some relief as well. So there's a lot of work that's going on from an integrative medicine perspective, but coming from MD to understand the integrative medicine is what we wanted to bring today on this weekend. Anything else you'd like to add? I know you also have a supplement line as well, but anything else that you'd like to add before I wrap up today?
Yes, I would like to add a couple more quick topics to be discussed. One is yoga and stretching. The nerve supply to the brain and to the neck are so intermingled. And a lot of people with migraine, they complain of neck pain. A lot of people with neck pain get triggers for their migraines. So exercises in the neck area, head and neck area, is extremely instrumental in mitigating migraine headaches. Also supplementation, as you said, as we talked about, we have in our practice, we've worked on this compound for a long time and we're using that. So that is essential also in people who, of course, do not want to take prescription medications, or they've taken it, it didn't work, or they had side effects. But psychological intervention is another topic that I think is important to talk about, because very simple things such as biofeedback and coping skills are definitely instrumental, especially in the case for tension type headaches. People with tension type headaches, the number one intervention that significantly may help you would be psychological interventions with biofeedback, which you can do yourself after the psychologist teaches you, and then coping skills and how to deal with stress. Because especially in the case of tension type headaches, stress is a big trigger. So how to deal with that is something that a psychologist can basically come and teach you. So we all come together from different disciplines, from a yoga instructor to your personal trainer, to a physician, psychologist, and nutritionist. We all come together to bring to you the most comprehensive and scientific approach, that because we know why you get, for instance, migraine headaches, and we will talk hopefully later about other painful disorders, but specifically to migraine, there is no anatomical disturbance. Let's say if you have back pain, a lot of times you may have a herniated or a bulging disc pinching your nerve. So it gives you sciatica. We can see that in the MRI. But MRI of a person with migraine almost always is normal. So there's nothing that you can find that you say, okay, here's the problem, I'm going to treat it. So you have to go based on the clinical findings and patient's history and make the diagnosis. So bringing all of these providers together synergistically to help the patient is basically what we do.
I think it's beautiful the way all the MDs are now moving towards the integrative medicine approach. You know, I remember a few years back, we would go to the MD and we'd take a pop-up pill, but nowadays MDs like yourself are really, integrating the yoga, the diet, the so many other things, which typically has not been taught in the past few years if you're going through an MD program. Doctors are not taught diet and nutrition and yoga, but now so many doctors, MDs, are transforming themselves and being an integrative medicine doctor. And that's what we wanted to bring today. Coming from MD, how an integrative approach, a holistic approach to any kind of health concern can help you. And today, of course, the topic has been on headaches and migraine. Anything else before I wrap up? Thank you so much, Dr. Taimoorazy.
Please send us your questions. I'm more than available. We'll be more than happy to be of help. And everybody have a wonderful day.
Thank you. Thank you so much. Our platform is going to be ready, and we have a dedicated section on pain management. So stay tuned, and we will inform everyone. With that, have a great weekend. Thank you.
Thank you very much. Take care. Bye-bye.